I'd like to call the meeting to order for the Price County Health and Human Services Board. Meredith, would you please take the roll?
Good morning. Joe Baratka.
Here.
Paula Hodak.
Here.
Robert Kopish.
Here.
Patricia Stephen.
Here.
Dennis Wortko.
Here.
Peter Daly.
Here.
Sally Hummel. Suzanne Acker remote.
Wait, is she here? Suzanne, are you there?
There was a caller on, but they went off. So it might have been her, but obviously when you're muted, you can't tell if there's anything. So we'll give her a second, but right now she is not present.
Okay.
Okay.
Just tell us if somebody comes on then, okay?
And also Gerald Swenson. Thank you.
All right, thank you. And good morning, everyone. Good morning. So we will have, first of all, public comment. Is there anyone with any public comment? Anyone online? Nope. Somebody just came in right now. Is it Susie?
Is Suzanne Acker online remote?
Hi, this is Susie.
Hi. Thank you.
Welcome, Susie.
Thank you. Hi.
All right, seeing and hearing no public comment, we'll move on to, are there any communications from the board? Okay, seeing and hearing none, we'll move on with that. New employee introductions. I'm going to have Kayla, if you want to come up and introduce. I think the microphone is already on.
We have one new employee in children and youth, Jasmine Marlinga. She comes to us from Adult Protective Services. She actually had been with the county for, I think she said, 1.5 years now. She is working in children and youth part-time, 27 hours a week, doing primarily foster care coordinator position, kinship care, and well, those are kind of the main things, independent living. We're really excited for her to be in this position because we've struggled to, I thought that was mine. Anyway, we've struggled to recruit foster parents for quite a while. We obviously have a crisis in not having a lot of local foster homes. We're hoping that she can really focus on that. A lot of times we've always had foster care coordinators mixed with like a juvenile delinquency worker or an ongoing worker. And what happens is those cases completely take over everything that we're trying to do in foster care because there's always crises there. So Jasmine is going to be able to hopefully take on those roles of recruiting and then also just like relationship building and connectedness, and if there's problems or issues or just reaching out once in a while to say, hey, how are you guys doing? Can we provide you any support? All the things we really haven't had a lot of time for. So we're really excited to have her and have that position, and she's got some ideas coming up here for recruiting.
That sounds good. Well, welcome again, Jasmine.
Thank you. Hello, everyone.
Welcome.
Did you want to say anything?
No, just hello.
Okay. Microphone was yours. And then Tiffany, you're up with Morgan.
Hi there. I'd like to present Morgan Eady. She is our new public health nurse. Morgan comes to us with some experience from OB. So we are very excited about that aspect. She'll be doing a lot with our prenatal care coordination where we work with pregnant moms, and she'll be working on the AODA Mental Health Coalition with some of our other public health nurses, as well as doing a lot of the clinic-based reproductive health, immunizations, and she's doing communicable disease follow-up. One of the things that we're kind of working on now is getting some of that case management portion done with that prenatal care coordination, doing a little bit more outreach And then she'll be working some with the targeted case management that we do, working with a lot of our families that that need services. So one of the good things with Morgan is many of the good things with Morgan. She's an awesome team player. She does come with that experience, like we said, and she's more than willing to say, "Hey, what else can I do here?" She's ready. She's raring to go for everything. So we really appreciate that. Do you have anything else to add, Morgan? You want to give them a little background on you?
No, that's okay. I look forward to working with all of you. So thank you.
Just a question, Tiffany. Your last name is YDE?
Yes.
I saw that on the org chart. I was wondering. Edie.
Yep.
Okay,
Yeah.
thank you.
So it's really exciting that we have, both Jasmine and Morgan, who are graduates of Phillips High School. And so that's kind of nice to have local people coming back to our community to help our community grow. Thank you very much. And we look forward to working with you. And I think I speak for the whole committee at that. Thank you. Okay, the vouchers, did they make it all the way around? Oh, Tricia has them. And Chrisanne is ready for questions. All eyes, all eyes. It's
Come on, there was
priceless.
3 months worth.
I know, and you're off the hook.
Wow.
Because I went through it last night and found some things I was going to ask, but my iPad has brain freeze. I left it in the truck at breakfast. And it's frozen, so
Oh,
I
boy.
don't
So I'll
have it.
expect an email from you later.
I will send you an email.
Anyone else have anything to ask Chrisanne? Well, so then hearing none, I would entertain a motion for that. Mr. Wardco,
I'll second.
and Mr. Kopish, first and second motion. So all those, any other questions, any other discussion?
Yeah, Chrisanne, when you don't get any questions, are you disappointed?
Not really. You keep me on my toes. Though, so
That's good. So if there's no discussion, I'm on ask for a vote. All those in favor?
Aye.
Those opposed? Okay, motion carried. Thank you, Chrisanne. And let's look for a motion for the minutes for the November 13th. Boy, that seems so long ago, meeting. Mr. Swenson makes that motion. Second, Mr. Baratka. Any discussion? Any comments? Okay, hearing none, let's call the vote. All those in favor?
Aye.
Those opposed? Okay, minutes carried. Thank you. Nutrition Advisory Committee, Council Member Appointment Recommendations. Do you want me to make those or? Sure. Sure, go ahead.
Yeah, do we want to get a quick history of why they're on here or how it gets to this point?
Sure.
Sure. Okay, so the bylaws of the Nutrition Advisory Council state that the Nutrition Advisory Council should recommend individuals for the Health and Human Services Board to recommend to the county administrator for appointment. So we went to the last Nutrition Advisory Council meeting with the list of names. They can only have 2 terms. The council reviews them, recommends them for this board to review and make the recommendation to the county administrator for appointment. Those appointments go on the county board agenda for confirmation. So that's how we got to this recommendation or this point.
So just a quick minute question for anyone who's out there listening as well. Are there requirements that they have to be part of the system or have had services provided?
I read the bylaws before we made these recommendations, and I don't
No,
don't believe on the Nutrition
Okay.
Advisory Council. There were on the COA, Commission on Aging, there are some requirements of
And we need-
age, location.
And we need one from each site.
Correct, yep. So the Nutrition Advisory Council, right now, we have them pretty spread out across the county, which works well. We are looking into one of the positions that some of us think it's a 2-year, they've had 2 terms. We have some meeting minutes that may allude to something else. So we're trying to figure out if they meet the bylaws. But otherwise, this is the group we have now, which keeps us going with a quorum for the next quarterly meeting. Otherwise, we're short members.
How many members are on that committee?
7.
7?
Must
Yeah,
be a
six
bunch
or
if
fifty-
there's
six
four
or fifty,
here.
there's 5, yeah, 7. 7.
How many? 7?
7 on that.
And this was 4 that were up this time, so the next time it'll be 3? Is that how that?
Yeah,
Yes.
kinda
and that's why
works?
we had to get it to this next meeting because there's not another board meeting before their next quarterly meeting. So then they couldn't have a quorum because they wouldn't have enough members.
Yeah,
And Jean Klomowski passed away, so she
That-
was on the board.
True. There's one replacement for Jeannie Klomowski, which that's why there's 4 this time.
is that the vacancy or is there another one?
No,
Is
that
that,
would be the Kathy Grell position, and
Okay.
will be,
is the vacancy Rita?
yes.
Okay,
Yeah, well, that's the one we're trying to figure out.
Yeah,
with
so-
the 2006, 2005 of when that person's term ends.
That's Phil, actually.
Really, yeah.
Phil's one
Phil.
is the
Phil.
odd one. So this was created in 2019. I have my notes. I didn't bring them in here because I didn't know we'd have this many questions.
well,
Um,
I talked to Rita yesterday and she's ready to be off.
I know, and she's so good.
Yeah,
But I think Rita's was, I don't remember. We talked to everybody at the committee. They were happy to keep going as long as they needed to.
Yeah.
We didn't have anybody who termed out except for Phil, we think may have termed out, but we also are looking at, was there a different timeline than what was on the sheet that we have, like, that we track it? So this brings us to at least a quorum so we can deal with the issue at the next meeting.
But wasn't there a discussion as well for Phil to extend
Right,
it?
so in the bylaws, if there's a failure to find an individual to replace a committee member, the committee can, or I can't remember who, somebody can give an extra 1-year term.
Right.
So it's like you can do a third one if everybody on the committee agrees to it. We've made this very restrictive for a quarterly meeting. That's really hard to get participation. So that might be something we look at is how do we make this more accessible to keeping it going?
So you're looking for a motion to approve the appointment?
To recommend, yeah.
Send them down to the county board?
No, so you're making, the motion would be to recommend these individuals to the county administrator for appointment. My appointments all go to the county board for confirmation
Okay,
via our
I will make that motion.
board law.
So let me read them so that it's on record. Okay. We have Kathy Farrell, term to expire 4/30/2027. She represents which Phillips.
But she's the one that's taking Jeannie. Klumowski.
She's taking Jeannie Klomowski's. Okay. Sharon Wade, term to expire 4/30/2027. She is from Ogama. Okay. Deborah Werner, term to expire 4/30/2027. I believe she's from Cannon, correct? And then the one vacancy, term to expire 4/30/2027 is from,
One
That
does
would-
not Need to be from a,
that
It
could-
was the Prentice area one, but it doesn't need to be from the Prentice area one. And that's the Phil one that we're still trying to determine.
Okay.
So we just put it on here knowing there may be a vacancy to discuss.
Okay. So your motion, Mr. Wartko,
second.
again?
My motion
To-
is to
Recommend these
recommend
individuals.
these to the county administrator.
And I second.
Okay, second by Mr. Kopesh. Any discussion at this point? Okay, seeing and hearing none. All those in favor?
Aye.
Those opposed? Okay,
So what you may see on the next Health and Human Service Board meeting is either Phil's name, because we need to reappoint because he ran out but still has terms available, or if the timeline's wrong, you may see nothing because he may have 1 more year on his current term. Or we'll determine that he's had 2 terms, he's ended, and we need another name. So those are the 3 possibilities that we have.
and
2
he was
2
at the
months.
meeting, so he would accept that if it.
Yeah, if it's
overlap.
him, he's willing to do it. If it's not, we'll have to find someone.
Okay. Okay, thank you so much. Number 6, Public Health Unit. Tiffany, you're on board.
All right, I have the Community Health Improvement Plan. I believe that was sent out prior to the meeting.
It's in your packet. It's this, yep, there you go.
I believe it was back maybe in August that I was with Michelle and we did an overview of the community health assessment. So this is the next phase of that. We take that assessment and then break that down into those areas that we made priority areas and then made the plan. So the first part of it was just a little bit of overview and then breaking down into each priority area, with the first priority area being mental health. And the first goal is to look at strengthening the mental health of individuals in Price County. And then we broke that down into our indicators so that we can monitor that progress as we go over the next 3 years. So this information was then also reviewed with the AODA Mental Health Coalition, as they play a critical role in carrying forth a lot of the strategies to work towards our goal. As you can see underneath some of the strategies, some of the activities that may be involved are a lot of community events, working with the school, communication, and then providing those resources to our community. Our second priority area was the alcohol and other drug abuse. Again, working with the AODA Mental Health Coalition is going to be critical in this area. So our overall goal there is obviously to reduce substance misuse among youth and adults in Price County. You could see the performance indicators that we have indicated there as well, so that we can monitor how we are doing as we go over the next 3 years. And then also providing strategies on that. One, making sure there's community awareness of AODA concerns, and then also increasing harm reduction opportunities in Price County. Some of those strategies, again, include just that education, working with the schools, and working with the community on resources, and carrying forth a lot of the activities that the AODA Mental Health Coalition has provided very successfully in the past, and that they can continue to work on.
Can I ask a question?
Yes.
Okay,
Sorry. I'm
Tiffany,
sorry.
you got a baseline, like on that indicator 211 of 10%, and the second one, 26%. You had those on the other ones too. What does that mean? When you say you're going to decrease something, is that what you're trying to decrease, that baseline, or what? What, I don't.
So by the county health rankings, the baseline was 26% of Price County adults report binge or heavy drinking.
Okay.
So that's the data that was provided to us with those county health rankings.
So if you want to reduce by 5%, you'll take that down to 24, roughly?
If we want to, we want to get it down so that by the end of this, we're looking at the next time that they do this report at the end of our 3 years at 2027, that we're looking at the baseline would at least be 21.
Oh, 21.
Yeah.
Oh, okay, not 5% of the number, an absolute 5%. Okay.
Yes.
Yep. Okay, thank you.
And then priority number 3 is our chronic disease. So we're looking to reduce incidence of chronic disease and morbidity in Price County. Again, a lot of the performance indicators we have indicated here, a lot of those come from, again, the county health rankings data. Some of them come from our WIC information, and other of them from the Youth Risk Behavior Survey. Some of the strategies involved with this would be our overall goal is building an active Price County. So a lot of activities are going to be revolving around providing and making sure that people are aware of those physical activity programs like Strong Bodies, and getting the activity resource guide out and about, and a lot of other educational efforts that we can do both in the community and in the school. Supporting a good, healthy food culture, continuing a lot of the strategies that the Health and Wellness Coalition has been working very successfully on. If I can remind you back to looking at when we were working with the bento boxes, when we were trying to support the healthy food culture and getting that information out, starting at the young age of those children, where we were doing that trunk or treat. It may look like, oh yeah, we're out and doing activities with the kids, but in a deeper meeting, getting that nutritional education out, meeting them where they're at, getting it into both the hands of the children and into the parents as well, and building those skills. So we look forward to continuing that. And then also with the other strategies, also access to care. As we know, we live in a very rural area with, limited doctor's visits may be available. We have our hospital here. They can provide the services that they can provide. They do an excellent job, but we do know that we have an aging population, and a lot of times people get referred out and they go much further than, an hour to get to a doctor's visit. So how do we, what do we have to do to kind of look at all of that? I know that the hospital as well will be working on that with their strategic plan, but what else can we do on our part of it? And it's looking at how we can provide that education to prevent chronic disease, so that we're trying to get ahead of it before we're having to do all of that, looking further down for medical visits and such. So our next steps with this was our plan for this is over the next 3 years. As you know, every 3 years we do the risk assessment and develop a plan. We do that in collaboration with Marshfield Clinic. The assessment portion, they write their CHIP, we write ours. And then we work with the coalitions and public health. We all work together and for these goals. And we will continue to provide updates during our annual reports, and so that you can see that we are working towards those goals and we are going to be hitting those performance indicators, meeting those. Are there any other questions on the CHIP? Sorry.
No questions for Tiffany? Okay.
Okay.
Thanks for that, Tiffany. Yeah.
Thank you. And then I will be sharing this with, at the state level. We do have to provide this for the 140 review portion of it. So this will be sent forward then.
Okay, so you don't need anything signed?
I don't need anything signed. I just need to show them that we presented it to the board.
Copy of the minutes then?
Yes.
So got it, or the agenda. Good. Okay.
All right. Next is our quarterly report for October through December of 2024. This is the first time I am presenting this, so I went off of Michelle's template that she had. So I hope that it makes sense. I know that's what you're probably used to seeing. So please let me know if you have any questions. So immunizations, as you know, October, November, December, usually public health is very busy doing flu shots, whether we're in the community, the schools, at local businesses. We were able to provide 67 flu shots at our community flu clinics, and then 194 of those at local businesses. And then we were also providing our COVID-19 vaccine, and you could see the numbers of those that were given during that time. We currently are still providing those vaccines. Currently, we are seeing an increase in the influenza cases statewide. So we are currently promoting that as we head in that quarter. Communicable disease numbers, you could see there was a decrease in that. That was largely due to a decrease in the number of, I would say, tick-borne diseases, where we're looking at Lyme, anaplasmosis, ehrlichiosis, babyliosis. So that's where you're seeing that decrease there. However, on the flip side, which we were seeing an increase in pertussis cases. So we were heavily promoting the Tdap vaccine during that time. The Tdap did provide that protection for pertussis. And I know we kind of reviewed that the last time that I had been here. So looking at some of our other services, we didn't have any cases for HIV partner services at that during that interval. Health check numbers, that is something that we continue to work on, just getting the word out that we do provide those services. WIC numbers, we have seen WIC numbers. They were up during that time. And our PNCC, targeted case management and reproductive health, were staying pretty much status quo into that quarter. Environmental, we didn't have anything too, not really many high numbers during that time. We were working at a couple of environmental complaints, and we were working on some lead follow-up. We did have one family that was receiving some assistance through the state for their Lead Safe Homes program. which was very successful. They were able to meet the needs of that family, remove the lead from that home, and we continue to see progress in that child's results. So that was a very good win for both Price County, for that family, and for the state. Dog bite or animal bites were down. We usually tend to see that those can be up in the summer, so that is a pretty normal trend to see them going down at this during that interval. Preparedness, I know this is going back to vaccinations, but when we do our flu shots in the school, we do that under our preparedness exercise so that when we treat it like it's a mass vaccination clinic. So in the event of, if we recall COVID-19, when we have to go and do mass vaccinations, this is our practice for that every year. We practice, we're giving those shots at those, but it makes sure that we have everything that we need if we would have to get everybody in one area to do those vaccinations. It has been pretty successful over the years, so we continue to provide that service. As you can see, as a result, 255 of our students and staff were in Price County School Districts were able to be vaccinated, and they don't have to leave the school for that. That's the nice part. We're able to provide that service, go there, meet them where they're at. And then going on, I know I spoke a little bit earlier about when I was talking about the CHIP, about the Health and Wellness Coalition. Here's an overview again of some of the services that they were working on during that time with very successful outcomes. And then again, with our AODA Mental Health Coalition, working on those sources of strength and working with our middle schools on the trainings that they were providing. They are also continuing to work on the resource guide and updating that. One other thing that came out of the coalition this time is they were able to partner up with with public health on during the flu clinics. And they were able to provide a sharps drop-off option. So when we were out doing the community health clinics, people could bring in, our residents could bring in bins of sharps that they had, and we would get them properly disposed. As you know, there are the permanent sites, which are located in the Park Falls and in our mid area here in Phillips, but there was nothing to the south end. So it was during those flu clinics where we were able to get down there, say, we're here, you can bring us your sharps as long as you're coming. And we were able to provide that. We were able to get, then if you look at the back page, there was a flyer that they had posted, and along with that, we only did collect about a pound of sharps during that when we were at our community flu clinics, but we were able to at least get the word out that this is how you dispose of your sharps properly, and these are the areas that you can get that out, and we'll continue to work towards that so that we are meeting those needs of the community to the southern part of our area as well, so that they're able to get those services too. So and then they were also still providing deterra boxes and lock boxes during that time. You can see those numbers at the bottom. Overall, public health, we still provide that community, that public health update. So I'm hopeful that you were all able to receive that when we sent it out at the end of January. If you have any questions on that, you can certainly let me know. And then we continue to provide information through Facebook and our public health webpage. Just the one thing I did miss is just if you're looking at the overall vaccine usage, we did provide a total of 946 vaccinations during that October, November, December time period, reaching 755 individuals.
Are there any questions for Tiffany? Yes.
On the health check, what does that consist of as far as if somebody was coming in for that, what would that be?
Yep. So health check is a Medicaid service that we can provide. It's a well child exam. So nurses are trained we cannot diagnose, but we know what the normals are. So we're trained, whether we're in the hospital setting or the clinic setting, to be able to do a head-to-toe assessment. So we provide basically a well child exam to children. We can actually do up to age 21. It consists of vision, hearing, just the listening to their heart and lungs, getting them set, and then getting them set up with referrals. If we find something abnormal, again, we can't diagnose, but we can connect them to one of the local providers and helping them make that appointment, and then following up with them to make sure that they're getting those services that they need. We can also do that for individuals that don't have Medicaid, and we can do it as a private pay. We don't have the ability to necessarily bill all the insurances, but it is something that we can provide. In the past, we have done those in the school as well. The school, the parents sign a consent just like they do for flu shots. And that way that we are meeting those kids where they're at. We pull it out maybe out for 20 to 30 minutes out of the school day. We're pretty good at knowing when like study halls are and stuff like that. So we're not pulling them out of math class that they probably want to get out of. But we are finding off of those visits, we catch kids if they're having vision needs, if they are having issues with skin issues or, anything that you would with a well child exam, and then following through with that. So. And vaccinations as well. We provide those during that time too.
Well, perfect. Any other questions for Tiffany? Okay, well, thank you
All
very
right.
much.
Thank you for your time.
Number 7, Aging and Disability Senior Services Unit, Chris Maybe and Dawn Griesel.
Hello. All right, so the Nutrition Advisory Council meeting, we held that on January 30th. It was in Brantwood. Some of the things I reported on, Kay Erickson was hired as the Ogama site manager in December. She replaced Phil Youngs. Patricia Comer was hired as our new driver for the Ogama Prentice area to deliver meals, and she replaced Bev Hartman. Also, Beth Eider was hired as the backup driver for Park Falls for delivering meals as well. Price County had an 81% redemption rate for the Senior Farmers Market Nutrition Program vouchers. So that was really good. We had one of the higher rates in Wisconsin for that. We see an average of 100, in between 90 and 100 folks that get meals every day between congregate and home delivered. We reviewed the financial reports that were supplied by Carrie that I brought to the meeting. Otherwise, then the individual sites just gave their updates. We hope to make this not such a less complaining meeting. So Brantwood, the majority of the meals were good. They want more butter. They discussed putting seasonings on the table because the food isn't salted unless it's processed, and then it comes salted. Kenan wanted more butter. Different things. The bananas were a little brown one day. Park Falls was overall satisfaction with the meals. And there was no report for Phillips. So
Chris, that's because we have butter and seasonings.
there you go.
Yes.
Mm-hmm. And then we just talked about the council member appointments at the meeting. Otherwise, that was it. Our next meeting is April 24th in Phillips at the dining site there.
Chris, the number I missed the number on how many meals per day we serve?
In between 90 and 100.
90 and 100. Okay, thank you.
And that's all for that one. Should I go on? The Council on Aging meeting was held December 9th. That was held here. Let me see here. So I just gave some updates, senior services updates. The Strong Bodies class in Brentwood is going well. There's 2 instructors there that take turns. The Try It session for Strong Bodies was from December 2nd through the 20th. Aging Advocacy Day, I reported that that's going to be Tuesday, May 13th, 2025. And I always want to say eat more, eat smart, move more, and weigh less. There's a health promotion class. We purchased 8 slots for that with wellness dollars, and all of those slots were taken, so that's good. Let me see here. The elder benefit specialist saw 31 new clients during open enrollment, which was from October 15th through December 7th. Transportation updates. We're up to 7 drivers now. I provided the BART bus numbers for the members. We talked about wait time for medical appointments. So we're going to, when a driver takes a client to a medical appointment, if they wait for over, I believe it's 3 hours. No, it was 3 hours. If they wait for over 2 hours at the medical appointment, they'll get paid an hourly rate every 3-hour increment. And it went from $7.50 to $8 an hour. We did increase the shopping charge for participants from $4 to $5 starting in January. We reviewed the number of meals chart. Let me see here. The Nutrition Advisory Council had advised to keep the suggested contribution the same for 2025, which was $5 for congregate and $5.50 for home delivered. And then I said we were always looking for volunteers to deliver meals in Phillips. So, and our next meeting is March 10th in Brentwood. Now do I have
Any questions for Chris on that?
Okay. So now the quarterly report that you should have received, right? Yeah. So it's from, again, October, November, and December. 70 people received home delivered meals between the months of October through December. And 178 people participated in the congregate dining program between those months. The total meals we had was 4,581 between those 3 months. The average is different every month, but for Kennan it was 9 meals per day, Brentwood 11, Phillips 15, Ogama 17, and Park Falls 37. Transportation program, our drivers drove 8,171 miles those 3 months and volunteered 265 hours of their time. I already reported the elder benefits specialist. It's the same. She saw 31 new clients. And the community outreach coordinator. For Strong Bodies during the quarter, Strong Bodies continue to operate at all sites. 3 class options are in Phillips, 2 in Park Falls, 1 in Catawba, and 1 in Ogama, along with a virtual option. There was the new site started in Brentwood in September. This class is offered 2 days a week, Monday and Wednesday from 10 to 11. In 2024, the following number registered participants for each site. Phillips had 54, Park Falls 56, Catawba had 6, Ogama and the virtual had 33, and Brentwood had 20. 44 of those participants were over the age of 75, and 67 participants were in the age range of 65 to 74.
Those are good numbers.
Cheyenne does, she's the kind of the coordinator for the Pleasant View Memorial Fund. And as a result, they were able to get one caregiver on the program to continue to pay for services to allow the care recipient to remain in their home, which in turn gives the caregiver some respite. The Eat Smart, Move More, Weigh Less program, that is an evidence-based weight management program. It's online with real-time classes with a registered dietitian. Like I said, all slots were filled. They'll be taking those classes in January now and in February. The class cost was right around $250 that we purchased those slots, and we ask for a suggested contribution of $25 for those, just like we do the Strong Bodies. And Christmas themed bingo was offered in Park Falls and Phillips during, I believe, December. So I think that's all I have. Any questions?
I see none. Well, thank you very much. Busy, that's for sure.
TCC.
Yep, oh yeah. TCC, we have Patricia, Stephen. Yep. And Chris, if you think of anything.
Okay, a summary of the transportation report, the BART bus department. Park Falls is continuing to be a highly populated rides service. They're maintaining their high capacity of rides. A lot of that is traveling to Minocqua for doctor appointments, dialysis. Phillips population up and down. We reported the highest October of last year was the highest since 2015, but then months fluctuate. Funding sources, Park Falls is funding $12,500. Phillips is still at the 10,000 level. If they're increasing anything, they haven't reported anything yet. Butternut, we still have a question mark as to whether we can receive any funding from them. We do a lot of high school rides for them. We are expecting an electric bus that's been on the waiting list for a while. Hopefully we'll get one in 2026. We did ask, we created the bus stop here at the Pick and Save. We were just making sure that was working out for everyone, and no one's reporting any problems. And if Nick has anything else?
The only thing I'm going to report at executive, because it deals with the Veteran Service Office, they did start free rides for veterans. I think it was last September or October. I don't have the numbers in front of me, but Price County was like 100 times more rides than any other route. Some routes got like 2 rides for free veterans. Bayfield had like 15. I want to say, and don't quote me on this number, it was like 680 free rides in Price County for veterans. So we're heads and tails above the rest in that program. It was so free rides for veterans. The TCC, or Bay Area Rural Transit, not the TCC, but the Bay Area Rural Transit Committee met, and they're going to continue that program for 2025 to do free rides for veterans. Last year, our Veteran Service Office did have funding available to put towards that program. So Tony from Veteran Service Office ended up putting $2,500 towards that program of ARPA funding that he had left over from the state. So that worked out really well for members of Price County. But I'll report more on that executive because I don't have the numbers in front of us.
The 680, was that all of 2024? Is that what that is?
It was only 2 or 3 months.
Oh, really?
Yeah, it was. And then I can try to find it quick, but it was when I saw the numbers, I was surprised. Give me 2 seconds here. Total number for vet service right here. Bay Area Rural Transit. We can share. So Ashland had some. So it's up on the board so in 2024 ride numbers, and like I said, it wasn't the full year. I can't remember if it started that September, October time. It was a quarter of the year. Route 1 and 2, which I believe is Washburn area, that had 23 rides. I don't recall where BG was. Bayfield something they call it. Granite Peak or Bayfield something had 5. Where was it? Grandview? Sounds right. I don't remember. Bayfield area had 5. City of Ashland had 258. Mellon had 1, and we had 652 in that first quarter. So successful program for Price County. Tony is part of that. He really pushed that program, knowing that there was free rides for veterans. The Bay Area Rural Transit, and again, I don't have the total numbers in front of us, but we are a high ridership transportation area, considering our population versus like an Ashland or so the program's working great. Again, each year it gets tougher and tougher to fund it because costs go up every year. And our was it 509, 529? What's your grant? 5821. I knew it was a 5. That grant is what we use to pay for this programming. And when we started it in 2019, I think was the first route. It was like 20,000, and we're at this point we've expanded to about 40,000 cost, a little bit more than that, but we're out of grant money. So each year we ask the municipalities for additional help, or we're going to start using the levy money. Bay Area Rural Transit does an excellent job at making sure they get the matching funds, they get all the things that keep those costs low. They get lots of matching funds for any expense they can put out there. So it works well.
Okay, our next meeting is scheduled for February 17.
So a real quick question about the BART bus. Where do these people go for these rides? Are they mostly for appointments in Minocqua or?
No, well, we
Is
do
it
have
just
the Minocqua route, and I want to say that's been very popular. They've had to work with the hospital because that's the dialysis. So they've actually made like a Park Falls or Price County morning where they head out right away at like 7 a.m. or it's real early. They get there. You sit there all day with the bus. The bus leaves, comes back over here and goes back and forth, but they sit there for 6 hours, 7 hours, it's like 5 or 6 individuals. It's quite a few through dialysis and then get them back home, which has relieved family members from having to drive over. They're volunteer drivers for the medical. It's become very popular. I would say medical to the hospital is probably the biggest usage up in Park Falls, but on the list, there's still a lot of people that use it for the grocery store. That Lakeside Clinic, so it's hospital, uses quite a bit. They also promote it. I want to say they give like tokens for rides for their patients to get to their appointments. We see a lot of library usage, people getting to the library with it. A lot of gatherings, a lot of seniors that in the winter don't necessarily want to drive. They'll all meet at the restaurant together. So the bus goes around, picks them all up. They go eat, they get home after the restaurant. Phillips at grocery store because we don't have that medical facility really to get to. We're starting to see that more with Tailored
Oh, good.
for those who use it that are not on Medicare, Medicaid. Trying to think of what else we see used. Dollar General gets it a lot down here, running up and down. Patty mentioned the parking space or the bus stop, and clarifying it's not like you could stand there and wait for the bus. What it is because Pick and Save is a one-way. So if you're familiar with the parking lot, you can only go out the north side out because it's one way to the alley. And when the bus would come in on Highway 13, they can't legally drop someone off with the door facing away from the destination. So when they would pull into the one way, you couldn't get off the bus and go to the Pick and Save. You have to be pointing because you can't walk into traffic the way the bus is. So they made a bus stop. It's the first two spots on the road. So they would come up to that bus stop. You could get off and you're facing the destination.
That's right on the street, right?
Correct. Yep. So it's the two spots right on the street going east-west facing Highway 13.
Just before the stop sign.
Right after the stop sign.
Right after, okay.
Yep. So it's the stop sign to Highway 13.
Oh, those two.
Right. If you were
Gotcha.
leaving the parking lot heading north
Yep,
on the one way,
gotcha.
if you turned right, it would be the first two spots are designated from 8 a.m. to 8 p.m. 6 to 6. 6 a.m. to 6 p.m. as a bus stop.
Okay, thank you.
Is there a chance to get some of these schedules for BART bus that I could take to the center and drop them off? And
Sure. They have his name's Nick that works for Bay Rail Transit,
Good
and
idea.
that's his role is to bring stuff like that around. We should have a bunch, either vets. I know Vet Service has a bunch. I believe Chris, you have a bunch. So if you want to talk to Chris, she can get you. She'll get you.
Are they posted at the other sites? The nutrition sites?
Most likely Phillips and Park Falls.
Oh, sure. But I know Brentwood has the nice big board there. It's pretty full of stuff. Might be buried under something, so,
not saying that they'll do anything, but
well,
at least it's
the option is there. Yeah,
make their own decision.
it's a good call, Gerald. Okay, anything else, Patty?
Nope.
Nope.
Oh, we're
Okay.
good.
All right, thank you for that. Let's have Dawn Griesel with ADRC APS quarterly report.
And I give Dawn a lot of credit for this report. She's been here 3 months. And of course, a month and a half in, they changed the programs. So she did a lot of digging. So it's the one that I handed out to you guys today. That is the report. So it's not the report that's up there. It's the report that I handed out.
Okay. So, hi, everybody. So yeah, I have learned a lot over the last 3 months. One of our biggest challenges was the state changing the reporting system for from WellSky to Pure Place. So that was a bit of a struggle, and at first, just a lot of glitches, a lot of questions, but it is going better now. I feel like people are more efficient working within the Pure Place system, and less questions, so it's going smoother. So that's a good thing. So with that being said, I haven't quite learned how to pull reports off of Pure Place. It is a little challenging. So I did my best on the report. So looking at the quarterly report, then referrals handled through the Price County branch would be 68 over the fourth quarter. And then we completed 13 long-term care functional screens to qualify people for one of the long-term care programs. And then 5 enrollments were completed in family care and MCO through family care. So that's either Inclusa or one of the other ones. And then 1 enrollment was completed in the IRIS program. So in the National Family Caregiver Support Program, an average of 8 people were enrolled in that over the fourth quarter. And then the Alzheimer Family Caregiver Support Program, 4 people were enrolled in that. So the discrepancy between why there's so many more in one than the other is that the Alzheimer one is harder to qualify for because of the income limits. National Family does not have income limits, so more people can qualify for that. So, moving down, then I'm just gonna say at the end of the year, those two programs did have some leftover funding. So we did offer the people that were enrolled an additional $500. And I will say that most of them used at least a portion of that. Because if we don't use that money, then it's returned to the state. So we did offer them some additional funds at the end of the year. And then moving down to dementia care specialist. So our newsletter subscriptions increased by about 100 over the last year. And so now we now have 340 people subscribing to the newsletter. So I think that is a very good thing and very successful in that we're getting the word out to the community. So more people seem to be taking that all the time. And then the dementia care specialist had 32 active cases that he was helping over the fourth quarter. The Phillips Memory Cafe seems to be going quite well. There has been an average of 8 attendees for that over the fourth quarter. And then the next cafe is scheduled for February 14th. So the support groups continue to be pretty well attended. Kind of dropped off a little bit over the holidays. So Phillips averaged about 4 attendees. Park Falls averaged about 8 attendees. And then the first virtual support group took place in November. And we had 4 for the first one. And then December with the holiday dropped off a little bit and only had 2 attendees. So I think the virtual support group is going to get more and more popular as word gets out there, because it's a great option for people that can't leave the home because they are a caregiver and can't leave their loved one alone. So I think that will get more and more utilized. And then November was Alzheimer's Awareness Month. So Shay did memory screenings at the nutrition sites. And that also was a very successful program, with him completing 14 memory screenings during that time over the 5 sites. So dementia-friendly trainings we had to postpone. Unfortunately, there were some conflicts with scheduling with the different participants. And so that is being rescheduled. And then we had the one class for the powerful tools for caregiver. So any questions about any of that? Okay, so then I'm going to move on to disability benefits specialist. So I would say that position is getting busier all the time. So I looked back at some of the figures and I can see that it's increasing. The number of people that she's working with has increased every month. So she's currently, over the fourth quarter, had helped 33 people. Now she spends 4 days in Price and 1 day in Sawyer, so that does not include the 24 additional people that she worked with in Sawyer County. So that position is really being well utilized. And so, yeah, I guess that's all I have about the dementia or the disability benefits specialist. Okay. And then on the back, you'll see just some numbers about adult protective services. So during the quarter, we did 3 new guardianships that were completed in the quarter. We did not have any emergency protective placements. Protective placement reviews, which is the annual review that's done every year for anyone we have under protective placement. We did 14 of them. And then guardianship consult referrals, 5 of those, and then elder abuse, neglect, adult at risk, welfare. The referrals we got was 27 during the fourth quarter. So any questions? All right. Well, thank you.
Okay, thank you, Dawn.
So I looked up the veterans numbers just so we're all on the same page. What I have the numbers, because it was from the December meeting, it's June through May. So it's a 6-month number, not a quarterly number. But the program started a month before that and there was no ridership in the May. So it was June through December. Program started in May of 2024. And I put that on my slide for tomorrow so that I have it ready.
Okay, I'm sorry, I'm trying to find my notes for the next thing and I can't find them. Or the governing body. Oh, let's see. No, I know, I don't, and it was a while back, so I know both Dawn and I are going kind of, no, no, no.
No, like I said, it was a week after I started.
Yeah, I know.
About just the discussion on finances and,
It was the financial,
yeah, I think there was a lot about financial, and I think they talked a little bit about, also how using the money for, advertising and promotions. I think they brought that up.
Oh, yeah, yeah. I can talk a little bit about that. You want me
I think that'd be great.
All right.
Sorry. And I believe that's what the majority, when I looked at the note or the agenda.
So I didn't bring any notes about it, but yeah, the ADRC of the North did get like, I think it was $67,000 to use for marketing. So it has to be used by the end of February. Right now, as a group, we are creating a video that we can use for promotions, promoting the ADRCs in the different counties. So that will include some testimonials from people in different counties, and will include information on all the services that we provide. There is additional marketing dollars above and beyond that video. So Sarah and Carrie and I don't know if we're going to have anyone else, but we're going to meet later this week and see what other potential marketing we could use that money for. So that 67,000 is not just for us, it's for the whole ADRC of the North. But I actually have a meeting today at 3:00 with the other ADRCs to talk about the video and any other ideas that we have. And then we're meeting on Thursday to discuss locally what ideas we have. So that is something that right now is in the works, trying to get the word out there more about the ADRCs.
perfect.
Any questions on that?
Not on that, but I do have a question.
Oh, yeah.
As far as family care in Wisconsin, there used to be several different providers throughout the state. Like we had one was Northern Bridges for our 10
Mhm.
counties, and that goes back 10 years ago.
Yep.
Is it just one now in the state? Or is it like Milwaukee has one, and or how does it work now?
Okay, so how it work, from what I understand, how it works is that the different providers have contracts. So in our area, there's actually two under family care. There is Inclusa,
Yep.
and there is one called My Choice Wisconsin, which covers the entire state.
Okay.
But like Milwaukee, they might have 4 different options down there, whereas up here we only have 2.
Okay.
Inclusive, My Choice, and then of course Iris, which is different. That's the
Well, Inclusa
self-directed.
was the spinoff of Northern Bridges, but it expanded to, it's got a bigger area now, right? Right?
Well, Inclusa, the way it works is it's a different company, but they bid for the contract
Sure.
with the state.
Sure.
And so whereas Northern Bridges used to have the contract,
Right.
now Inclusa has the contract.
Right.
And it covers perhaps a larger area because they maybe got the contract for different parts of Wisconsin,
Yeah.
in
okay.
addition to our area up
And then
here.
there's My Choice, which is a whole state.
It's statewide.
Yeah, okay.
Yep.
Yeah. All right. Thank you.
Okay. Anything else?
No, maybe once you, over here.
Oh,
Dawn.
sorry. I'm
Sorry.
looking.
Yeah, someone's talking to you.
Yeah.
It would be interesting to hear what your committee is coming up with the video. That'd be nice. Maybe an update on that. If you
Yeah.
think you're ready next month for the next month meeting to present
Okay.
or in the future.
I think we will be, because like I said, the money has to be used by the end of February. So the video we're doing should be produced and done by the end of February. So I don't know when the next meeting is, but perhaps we could even view the video.
Oh, that'd be nice.
At that time.
Yeah. Okay, so
Yeah.
we'll put that down. Okay.
Okay.
Thank you for that.
All right,
All right.
great.
All right, let's move to number 8, Behavioral Health Unit. We have, Chana is not here right now, so Sarah is.
So I thought maybe what I'll do is, because what I wanted all the managers to come and, go through the programs. So what I'm going to do is, if we could do this next month when Shauna is available, then she'll be able to go through this for like questions and go a little bit more into depth with the quarterly report. So I thought we would hold off on that one.
That sounds good. Okay, let's go to Children and Youth. Kayla. And I think the information is in the packet as well, right?
I guess as I was listening to everybody else, I'm thinking we kind of are just going to be talking about out-of-home placements. We do a whole lot more than just out-of-home placements, but I think we focus on that a lot because it obviously is a big expense to the county. So as you can see with the first slide here, we have 12 kids that are placed out of county and 11 kids that are placed in county. And then I guess just moving on to the next slide right away, because that kind of shows more about how those costs break out. So just to explain, like the numbers probably don't really add up, seeing as how it says court-ordered relative and kinship placement, there's 12 of them. And there's only 5 in local foster care. So of the 12 or the 11 that are placed in county, the 5 of the local foster care would for sure be part of that 11. However, depending on where they're placed, like court-ordered kinship care or court-ordered relative placement or kinship care can be out of county. So that's, and some of them are in county. So I don't have the exact number of those, but those first 3 sections would be any of the kids that might be placed in county, because we don't have treatment foster homes locally or group homes locally or residential care centers. I guess just a little bit about one thing that I think is kind of has been a positive change is that I believe just starting January 1, 2025, there's a new movement for there's a new rule for like kin, being able to place kids with people that aren't considered relatives. In the olden days, as in 2024 and beyond, we had to place kids in foster care, or the people had to be licensed and had to be able to be licensed. And the state, I guess, didn't really recognize that close family or close friends or people that are close to kids are also kind of like relatives in a lot of the families that we work with. And so I don't understand how it took so long, but in 2025, now we are able to place kids with really close family friends if we want to, and they can be considered like kin. So they can choose to not be licensed if they don't want to and receive kinship care payments versus become a licensed foster home for the county. So I think that's going to be huge moving forward, and we'll probably keep Jasmine busy as we're finding friends. And we had a child that was local in one of the school districts and struggling to find family members, and a teacher actually stepped up. And then when we talked to the person from the state, she said, well, actually we could consider that like kin, so instead of saying there was rules when it was a non-family member that like you can place there, you have to do these background checks, but you have 30 days to get that person licensed and they have to commit to this being licensed. Whereas now they could say, you know what, we'll take them on and we can pay them kinship care, even though they're not relatives. So that's huge. Again, it just seems so odd that it took that long to figure that out. Oh, go ahead.
You know, I was going to ask a question. I haven't.
Nick, give me a point.
Oh,
Yeah.
Okay. How is she reading my
Your
mind?
finger's on the trigger, and I'm just like, over here, over here.
Stop watching me.
Sorry.
Just so I understand what you just said, out of the
Oh, sure.
11 placements we have in county,
Yes.
and going to the next chart,
Yes.
you got 5 that are local
Yes.
foster, and
Yes.
that's with, we have how many, 6 providers?
Do we only have 5 now?
No,
I have
no.
6. We'll go with 6, sure.
6 providers. Okay.
6 and declining.
The other 6 are in what categories on here?
The other 6 would be mixed up between subsidized guardianship and the court ordered. Yeah, probably the court ordered relative would be mostly, because after,
Okay.
yeah. Anyway,
Okay.
somewhere in there, not the other homes.
And then I get questions about this whole thing with the foster care.
Yeah.
And why can't we do this and why can't we do that and all that kind of stuff. People don't understand the process that you have to go through. They figure that your workers can just go, if they got a problem, go just take the kid out of the house and do something with the children, and do something with them. Well, it's not that easy.
Right.
Can you kind of go just briefly through the process on what you go through when you first become involved?
Sure. So as far as foster care in general, you mean like, okay,
Yeah,
so
where
like,
you run into a situation where there's children at risk,
yeah.
and from that point, what has to happen?
Yeah, I could I'll try to narrow it down a little bit.
Yeah, maybe
Sure.
30 minutes or so.
Yeah, oh, no problem. um, so there's a lot of things that go into when a child is being placed. First of all, you're in an emergency situation. So that's why it's really nice to have foster homes, because all these background checks and things are already done. We've already determined them to be a safe place. But when we're looking at relatives or now this like kin, we have to be pretty confident right away, because this is, 6 o'clock on a Friday night or any night of the week, and we don't have all the sources that we need to have to look into things. So we're doing CCAP checks. We're doing our EWIS-SACWIS, which is our statewide system checks, sex offender registry checks to make sure there's nobody living in that home. We're taking down all the information of every individual who lives in that home and doing background checks on all of them as well. And honestly, if there's any type of, I shouldn't say any type of scare, we're not placing with them, and we're looking for local foster homes. Obviously, certain things are helpful. If a teacher is coming forward and has a relationship with them, we have a level of knowing that they've already had a lot of background checks done. They're local to our community. Usually we know them, we know the things that are going on. So it's a little bit easier. When people have to be like, even dads that have somewhat of visitation with, not just dads or moms, but if they have somewhat of visitation with their kids, but it's infrequent 4 times a year, we're not necessarily looking to place there either, because we don't want to take a child out of one situation and just put them into another. So there is a lot that goes on that evening or that 2 weeks of trying to figure out where this child is going to go. Once a person is like interested in becoming a foster parent, there's packet. How many pages would you say that packet is of things that they have to fill out? And then there's multiple visits to the home that have to happen. There's more significant background checks, the bid, checking where they've lived in the last 5 years and sending that paperwork out, and then training, foster parent training of 30 hours.
30 hours if you're a general foster home.
Yeah. There's just a lot that goes into any time that we're considering placement. If we're looking at aunts and uncles, how significant is your relationship with them? Do you see them on a regular basis? Who else lives in your home? And then we run into a lot of, complaints that way too, where parents want them to go there and we're like, well, yeah, but this person that lives in the home is not safe. And so, there's a lot of decisions that are made on a really quick basis. And if we have reservations, we just take a little bit more time to figure that out. So does that answer it, or? Oh, yeah. So when we place a child, we have to take them into temporary physical custody on that evening. And within 48 hours, excluding the weekend or illegal holiday, we have to go to court and have to prove that to the court that we have reason enough to be able to take that child into custody. And within 48 hours. Yep. And then with that, of course, there's all kinds of paperwork that has to be done. So there's the TPC form. There's something called a UCCJEAA form that has to be filled out, where we have to talk about where they've lived over the last 5 years to make sure that we establish jurisdiction and other people that are involved. There's out-of-home care packets, part A and B, which are thick packets of information about the child that we would need to know. And of course, it's really important to know on the night of placement, like, are they taking medications? Are they allergic to anything? What's their favorite thing? What helps them sleep at night? Like packets and packets of information that we have to go through for that. So yes, within 48 hours, we're going to court for a TPC hearing. Within 30 days of that, we're going to court for a plea hearing, where there's a petition filed prior to that and they admit or deny or plea no contest to those allegations. Within 30 days of that, if they deny, we're going to a fact-finding hearing and or a trial about that. And within 30 days of that, we're going to court again for a CHIPS, Child in Need of Protection Services Dispositional Report, which is kind of like a social history and a 20-page document that's drafted about the whole family and the people that are in their home.
That's the part.
Yeah. And on hopefully, we're always making sure that they're either with one of those people that we picked. And so those are all the moving parts of that as well. So like, we might place a child locally in foster care and we're looking for relatives. And if we can do some of those background checks and feel like they're safe, then we'll move them with that relative. The problem is sometimes those relatives aren't local, some are.
Another foster home that you prefer
That's what our hope would be, and we're running out of those, and so it's scary. Sometimes we're borrowing foster homes if we have good relationships with surrounding counties, but then we're traveling to get them to try to keep them in the same school district. There's just a lot of decisions that go into. Yeah, absolutely, yeah, and we do too. We do too. We spend a lot of time with them. Mhm. Yeah.
Kayla, do you want to? I think we got ahead. Like you're talking one specific type of care, or when you get in, work with a family. But there's also the ones that are just, hey, we're starting to work with a family. There's issues, and then
Yeah.
there's the emergency. Oh, we got called at 9 o'clock at night because there was a incident and police are involved. What I think that's kind of what you went over just now was there's the quick and
Yeah.
always the midnight. It always happens at
Yeah. Well, I was thinking that as everybody else was presenting, I wrote a list of things that maybe we should grab some statistics on as well. Is just, yeah, there's lots of times where we're just trying to we're doing a Child Protective Services investigation. And honestly, most of our investigations don't result in removal. We're either determining we don't have a right to be involved in their lives and we did this investigation and it was unfounded, or, hey, we need services. And so we have 2 family skills workers that we can sometimes provide voluntary parenting services if we think that's what's fit. We used to remove a lot of children based on conditions of the home. And now I've talked about that TSSF funds before. We'll still go out on an investigation regarding significantly horrible conditions of the home. But a lot of times we're placing the whole family together somewhere using those funds and helping them get that cleaned up so that we can keep the families intact. So, yeah, so we do Child Protective Services investigations that don't include removals. We can do something called an in-home CHIPS where we have those same court-ordered conditions, but we're working with the family while they're at the home together intact. We might have safety checks. We might just have an ongoing worker and conditions that they have to meet. And then we do other voluntary kind of just checks, hey, sometimes we'll do something called, we screen out an investigation, but we'll go out on a child welfare where we'll just go talk to the parents and say, hey, we received this information that these things are going on. What can we do to help you? Or are those things going on? And we'll provide services that way.
So on an investigation, that's not an emergency situation, and you determine that the child should be placed outside of the home, that still goes through the court process?
Yep.
Okay.
Yep. And then going back to I guess our statistics here of that's just children, or that's just Child Protective Services. And then that's our investigators and our ongoing social workers, and then our family skills workers that kind of work in that. A lot of these placements also include youth justice referrals. And so you see the placement costs for treatment, foster care, group home, residential care. Those are just, I guess I don't know if anybody has any questions about that. I myself, when I was looking at these stats, I'm like, holy cow, $109,000 for 3 kids that are placed in a group home setting. So I had to go back and do the math myself a little bit. And so we had 2 youth that were placed at Prentice House group homes. And what I would say is those youth needed to be there. Of course, we work with a lot of youth locally that are not placed, and our youth justice worker is basically like a probation officer. They're coming to the office, they're meeting with her on a regular basis, they're doing community service work, they're going to counseling, they're attending school, and we're following up on all those things. But when they continue to commit crimes to the point where they're a threat to the community or themselves, then we're looking at placing outside of the home. And most of the time, the group home setting would be those youth justice kids. And so 2 of the kids are placed up at Prentice House in Ashland, and that's that costs about $8,400 a month for them to be placed there. There's 1 youth that's placed at a group home, and that's $16,000 a month. The happy news about that is that youth was placed in a residential care center prior to that, with some pretty significant issues. And we were lucky enough to find a group home, even though it's very expensive, that is a lesser placement, a lesser cost, but they provide really intensive supervision services and specialized treatment for a youth who has extreme sexualized issues. That would be a really huge danger. So usually you wouldn't see that high of a quarterly report on a group home, but that group home has required more money as a result of I mean, this child's being suspended from school not every other day, but every other week. And their school is really great and is working with them and working with the family, but they're just, the other kids I would say are kind of doing a little bit better. So.
How many non-cases do you have a month? You
Yeah.
know, where somebody makes accusations against somebody and you got to check it out. How many of them do you have a month that you don't have to really do a whole lot?
Yeah. I don't know. I guess if I was throwing out a number without giving you numbers, I would say, what would you say, Sarah? 12 to 20. But with that being said, just so that you understand, like that could be a family of, let's say, 3 kids. So that still requires, going to the school, interviewing 3 different kids, maybe coordinating with law enforcement, then getting to the family and interviewing the family members and making those determinations. And they still might need services. So we might still be providing them services. We're just not to the point of like, we need to take them into custody. And we try at all costs to not place kids in care if we can. Yeah. Yeah, I would say. And I was thinking I could probably get some stats on that. Anything else? Okay. And then I guess just our last, there was one more slide.
Stuff down too.
And I guess I just fairly self-explanatory. It just kind of goes over the last few years and what our out-of-home placement costs have been annually. Obviously 2021 was a pretty awful year, and I feel like the years preceding that were not very wonderful either. Then they started going down, and now it's maybe going up a little bit. I would say like right now, the reason, and I don't, I obviously can't predict the future, but we just have a lot of high needs kids. And so even with the same number in out-of-home placement, we had kids that had to go to residential care centers. And I've talked about the cost of that before. One assessment for 37 days, which we use as little as possible, is $34,000 for 37 days. We have been pretty good about trying not to use those, but we get to situations where there's nothing we can do about it. So I think that is why our numbers are up, is because all of these places cost a lot more money. That same assessment when I started 17 years ago was $8,900. So
Kayla, do you want to talk about, the state has put in place a couple programs we talked about, I can't remember where you can help the family in different ways, which the state has been very excited about the program, because paying for a $200 tire repair on a person's vehicle so they can get to work, which then they can help support their family, is a lot more economical and better for the family than taking those kids and putting them in placement, because parent can't.
Yeah. That was the TSSF funds. And I think I've talked about that before, but again, that was just kind of the program that, if we go out to a home and we find there's enough risk, there's something that we have to do called a protective plan or a safety plan. If we can develop something, and we manipulate it a little bit just to be able to use those funds to be able to help the families. But if we can use one of those safety plans, it's the funds that can help put people in hotels while they're cleaning up. We can get them cleaning supplies and get that home back to where it needs to be. We know that home didn't get that way overnight, so then we still try to provide them services, and those funds can help with those services as well. I think I've talked about before, it felt so wasteful having that money and being able to spend it. I'm like, I can buy them what? So I'm like purchasing a washer and dryer, which are things that we all have in our homes, or we're usually lucky enough to have in our homes. The level of stress that it brings down in that family, not having to pack up 3 kids and a laundry basket full of clothes and not having enough money for soap. Like, it's odd that those things can help keep kids and families intact. And like Nick said, we've helped with car repairs and we've helped with tires that aren't safe. And so people can get to these appointments that need to happen. So
The other area we're seeing too at the state level is they're recognizing that the categories in which the services falls, specifically mental health, is a priority, is the mental health, but we're taking costs that we're still incurring, but we're categorizing them under the mental health area, which may receive different funding from the state or federal level. So one area goes down, you'll see on a report that the other area may go way up, because it's still being helped under the department. It's just the category in which the funding's coming from. The state's addressing that more and more each year, especially mental health costs. But those things have helped, right? The
yeah.
different programs, like you said, the state recognized that placing a child with a close family friend is important, and it is good for the kid and fiscally.
Yeah.
What is our grant now for TSSF? Because it's not, it's not funds that never end. We have a cap of, is it
Yeah.
it used to be 19, now it's
I think it's gone up since then. I don't remember what our allocation is for this year, but I think it's probably 24,000 or
24
something.
rings a bell. I was
Yeah.
going to say 24. And then we even talked about it, knowing it's how successful it is. If we hit a point where we use that 20 or 24,000 and we still saw a need, that's something we would ask for. We would say, this is important. This is going to save the county X dollars by continuing to either fund it or give additional funding.
Yeah,
in
they
this area.
they put caps on things. Like, so we like to use it a lot for these emergency types of situations, like I'm going to a hotel or helping to get things in place, paying for first month's rent and security deposit so they're not living in a homeless shelter. But they do put a cap on that, and then they make us do more for the ongoing. We like to use it for the emergency stuff, but we do run out almost every time. So,
One last thing, maybe. On the 2024 numbers on here, you've got different coloring for different amounts.
mhm.
Is there a reason for that?
I think that they were color coding and they didn't put our little,
They didn't put a legend on it.
Yes.
Yeah, okay,
but I'm guessing that that has to do with the different placements.
yeah,
different quarters.
okay.
First
yeah, and the
quarter,
quarters.
second quarter, third quarter, and fourth quarter.
Oh, is that what it is?
Oh, okay. I'm
Oh,
sorry.
that's
Yeah.
the quarters.
That would make
Yeah.
sense.
Oh, okay, all right, so that the total there, okay, thank you.
Yes.
What's that? Oh, no, I was going to thank you for what you do. I don't think most people appreciate all the stuff you go through in dealing with these issues.
Yeah. Thank you.
And I have some experience with people that we know and the stuff they have to go through. And it's always, well, why can't you do this? Why can't you do this? Well, you got to understand.
Yeah.
There's a process we have to go through to make sure everything is taken care of. Even looking at the statistics that came out of the health department regarding the mental issues and all the stuff in the schools, I was in high school in the last millennium. It's way back there. And I don't recall all this stuff. And I don't know if our society must have changed tremendously in that amount of time where we're running into so many of these issues with so many of our children. And that relates back to what you're ending up with.
Mhm.
And it's a big job. And thank you and your department. And I'm sure Jasmine's going to really help with this communication and all this stuff so people understand everything. But thank you.
She's good. She has that skill.
And I don't want to belittle the rest of the department, but you guys got a really difficult job.
I appreciate that. Thank you. Because I was looking at our stats. I'm like, I'm only talking about 12 kids in out of home placement. There's so much more than that.
Yeah.
So I
It is.
appreciate that. Thank
Yeah,
you.
thanks.
Kayla, the number of times you communicate with me and Sarah, it feels like more than 12 kids.
I know. Yeah.
Sally.
Place. I mean, and to appreciate it. And I think that's what we got to think about as the children.
Yeah.
The children didn't choose where they're living, and we have to help them.
Yep. And it's a tough job, and we know that, and we want to be supportive of foster parents always, of course, but it's a tough job.
It was a foster parent, and I know what it's like.
Yeah.
Do you see anything,
17-year-old girl, 17-year-old girl.
Yeah.
It was a hard one.
do you see any particular issue that's causing the trend to come back up again, or is it just cyclical?
I was thinking, I kind of wrote down like the cost because like I said, I started looking at myself, and I think one of the issues is, of course, the higher cost of these same placements. Like they just go up all the time, and we're kind of at a rock and a hard place because we don't have anywhere else to put kids. And actually, these homes are providing really, really good services. The other thing is the lack of local foster care does make it difficult. And we have some really great foster parents, but our foster parents they've been doing this for a long time. And they're not going to be around doing this. Actually, the Lins I speak about,
Oh,
they've already been ready to be done a few times, and then they'll I saw them at a basketball game. We're not ready to be done yet, so we hurried up and got them relicensed, and I'm like, thank you so much. And guess what? They have another child with them, and so that would help to have local foster care.
We used to have a Big Brothers Big Sisters program too. That was so helpful.
Yes, that's true. We do talk about that a lot is mentoring. If we had some sort of way to be able to have a mentor, we do incorporate it into one of our grants. It's just kind of on a minimal basis because we don't have the funds for it, but you wouldn't believe the impact that a mentor has on a kid. Somebody that would just take them out and take them ice fishing, ice skating, for a walk, kayaking. It doesn't have to cost a lot of money, but we do need to pay these people to do it. And it's hard to find the money to do that. But it is huge in preventing out of home placement. I could name a few off the top of my head that wouldn't be where they are today if they didn't have those people.
The trend is upward because of monetary costs, but my question, I guess, is do you see anything in the community or something that can be done so we don't have this issue? Or is it just going to be ongoing, that's just the way it is?
I think it does ebb and flow. I think about that before I come to these meetings and think, oh gosh, now I gotta talk about why we're back up to $500,000. And I just got done telling you TSSF was so successful. And I think sometimes you just can't help it. I don't know what the community could do besides for that mentoring, like Paula had mentioned, that Big Brothers Big Sisters program would be huge because that was free to the kids and the youth. If there's some way that we could find grant funding to do a mentoring program specifically, I think that would be helpful to keep kids in out of home care and the safety checks and whatnot. But I would say that of this group that I'm thinking of right now, at least quarterly, we've had some really tough families and, like a sibling group of 4 that has really, really tough behaviors that local foster care and family members wouldn't be able to handle. So I'm sure there's always things that we could do, like the Big Brothers Big Sisters or mentoring. It would be the first thing that would come to mind that people would mention. Even just respite homes, if we could get the word out, somebody who could give the foster parents a break on the weekends. That kind of stuff might be helpful for local, but
I think another one that I thought of is the schools. I mean, the schools are a huge part of this, and having the staff that doesn't always seem like, oh, it's not a teacher in the classroom, but it might be the counselor, it might be whatever services they can provide, but their funding's also tight. So when their funding goes down, those positions that are helping mentor or however it might be are the first ones to go, and then you start to see that uptick again too. It's hard to find staff even if you do have the funding. The after school programming, I mean, Park Falls lost their funding 2 years ago. They still do some programming, but that was a huge thing that they lost funding to. I mean, there's a lot of families that don't have care after school, which then puts them in positions where these kids are not with somebody that
because those programs like the after school program are intended to be so that they can get to the point where the school and the community can sustain them and not the state. And so that becomes a problem when it's a monetary issue.
And speaking of lasting relationships with you guys talking about that, not dissing on any of the schools, when different organizations are in crisis, then we're in crisis. And I would say, this is maybe just my opinion, but with working with the schools, there's more and more people hired that aren't necessarily trained in special education services. And so that relationship building thing that's so very important, we're lacking that a lot. These people, the staff members aren't trained or know how to handle these situations. So then the school's reaching out to us, like, do something with these kids, get them out of here. They're horrible. Like we can't manage them. And we're like, no, the school needs to do this. And we're getting people involved in whatever, but it's really turning into a major crisis with we have, I would say, a staff ratio of less teachers than paraprofessionals who are, it's scary. Some of these numbers are up because of that, where when you have those really good people that can handle some of those, think outside of the box and can connect with these kids, it's just huge to them.
That's something. I have relatives in Minnesota, and they have free breakfast and free lunch for their school kids. And attendance has grown wonderfully, he said, because kids will get up, they're going to from homes like that that don't have food and that they're there for both meals. And they said it's one of the best things that state Minnesota has ever done for families. So you just think, you know,
Mhm.
and you think about it.
Yeah.
If you're hungry, you will get up.
Well, I mean,
Get to school.
we use a lot of safety stuff just based on the school. I mean, we know kids are safe and being fed from, until the end of the day. So, yeah.
That's why the pandemic was really hard,
Yeah.
because you didn't have that. Okay, anything else for Kayla?
I'd just like to say thank you also to you and your staff for what you do.
Thank you.
I think we all parrot that. Yep. Thank you so much. All right, let's move on to Jenny, are you still here? Come on up, please, Jenny, for Economic Support Unit.
Good morning, everybody.
Good morning.
Well, there it is.
You are.
Okay, so what I put together was the quarterly estimate, but on a monthly estimate, so that it just breaks it down to, what's actually happening on a monthly basis. So the food share case count, and I put both Price County statistics and then also the Northern Income Maintenance Consortium statistics on the other side. And if you just follow it across, it pretty much goes, they're side by side. Because we are part of the Northern Income Maintenance Consortium, and that's 12 counties that we do the call center for. So those, of course, statistics are quite a bit higher, and they don't break that down on a monthly amount. So we'll only see that on the Northern Income Maintenance Consortium side. So the food share case count for our county is about 1,024 per month. And the recipients, that would be like, of course, children, spouses. So that's why that's at the 5584. And then the issuance amount, and this is per month, to our county is 200,000 well, you see it. And then, so when the consortium, when we're looking at their side of it and the applications alone, and that also we can't break down to just the county, was 1148. So that's new applicants every month for the 12 counties. And then there's like 15,000 cases. And for the recipients, there's like 29,000 individuals. And then this is the monthly amount is for the 12 counties is 4,164,948. So then we go into the total applications for the consortium is the 1,543. And our MA cases just for Price County are 2,459 recipients. And that's, of course, because there's children, 3,902. And then it's broken down to each individual types of cases. So there's the Badger Care childless adult cases. So those are those without children. And then the recipients, and then elderly, blind, or disabled, the 181, and then the recipients. And of course, those are real close because usually it's it's your small households and maybe there's some spouses, and that's the reason why it's so low when you look at the recipient count. The Medicaid purchase plan, that's where the person receives medical assistance. It's a special program that there is, you can have higher assets, a little bit higher income. There's a mandatory $25 premium now on the Medicaid purchase plan, but it gives them that dual coverage. So they have Medicare and Medicaid. The Medicaid savings program, that's where they get the Part B premium back on their check. So if you're income eligible, asset eligible, then you get the $185 back on their checks. And for a long-term case, that your long-term care cases, that's your nursing home, and then also those COP waiver people or IRIS people that are in their home and they're having services come in. And then the other IM cases, the caretaker supplement, that's for those individuals who, the parents are receiving a social security supplement. And so they're very individualized, special cases that if they have children in the household, they can receive a payment for those children in the household because they are on a social security supplement, which is very low income. And so that helps bring some money into the household for those children. Way back when, that used to be the Aid for Dependent Children, but when they got rid of Aid for Dependent Children and turned it in the Wisconsin Works program, where there's that trying to get the people who are not disabled into the workforce and have a worker that would be there, like help them do an employability plan in the past. So there's still the Wisconsin Works program. The county we do not do that on the county level, but we refer to that program, and they help those individuals get back into the workforce. But with these people who are on the Social Security supplement, they're not able to get back into the workforce. So then they turned it into the caretaker supplement so that if they were disabled and receiving a Social Security supplement, they could get a payment through Social Security, but we do the eligibility determine if they can have that payment. So that's caretaker supplement. And then childcare, the families served in Price County estimate 8, and the children would be 13. And that per month is about $4,028. And then for the consortium, it's $227,605. And the children served are like 366. And the calls that we do is right on the top because that's not, they don't break it down by county. So the calls received by the consortium per month are around 8,537. And then per week is around 2,134.
And we also get calls, just not our county. So
Yeah, we're part of the 12 county phone system. So we are like on the call center answering those calls for the 12 counties. Any questions?
Yeah, just quickly, all these cases, these are existing, ongoing, open cases. Is that
Yes.
That's what they are?
Mhm.
Do you have any idea, like, how many new cases out of all this we end up with every month, or?
That's this, like on the county level,
Yeah,
that is the total of the MA cases, that 2,459.
that's per month?
Yes. Well, that's existing, ongoing.
Yeah, okay, that's.
Yeah, and then your applications, they weren't able to break that down per county, but
Oh,
your
okay, that's where you would see
existing,
the-
ongoing cases
Where you would see there's
Yep.
1,500 applications for the
for
whole
the
group,
consortium, yes.
and we're part of that 1,500.
Yes.
Yeah, okay, all right,
Mhm.
all right, thank you.
Mhm.
Any other questions for Jenny? It's overwhelming. Thank you, Jenny. All right, Carrie. Last but not least, fiscal administrative unit.
Okay, good morning. So here you'll have the high cost placements that we do every meeting with the children and youth, which Kayla did talk to quite a bit. Also too, while December has come and gone, we still are getting in invoices and costs too. So you can anticipate both children and youth and also behavioral health's high cost placements to still increase. Probably come next meeting around March, that'll be more of the solid number. I do know that there were other placements too within behavioral health in December, so we'll see those start coming through and reflecting on the report next month.
Go ahead.
Do you happen to know, Carrie, what the budget is for 2025 in these two areas?
I don't off the top of my head, but Nick might be able to look it up real quick.
I do believe the children and youth one for 2025, we lowered slightly. Carrie said the other Carrie will be looking, but we moved that funding over to the AODA.
So the total between the two is about the same.
I would say within 100,000 between the two. Yeah.
Yeah, there
And
wasn't a huge changes.
It's about 1.2 million, and that's about where we are, actually.
Yeah.
Yeah.
Yep. So we met the two actual. Yep.
Okay.
So at the end of the year, we believe we're good for 2024. We reallocated where in 2025, but didn't maybe reduce 25,000. It was not a lot if we
Mhm.
Okay, all
changed
right,
anything.
thank you.
Any other questions?
And I guess another with the budget stuff, we didn't add a whole bunch for the AODA or any of those high cost placements because our hope and our thought based on all what we're hearing is there is going to be more funding for the mental health area. So we didn't want to start cutting other areas to know that it's a 1-year problem or a 6-month problem until the state does say, we know there's a high cost of mental health issue. You know, don't cut somewhere else knowing that there hopefully is. Right now we're break even. We didn't need to cover issues.
Okay,
All right, thank you.
thank you. Sarah, you're up.
Okay,
Director.
agency up. The aging and disability. When Dawn had talked about the National Family Caregiver Support Program and the Alzheimer's Family Caregivers Program, where we had money left over, what we did was we wanted to strategize because we did not want to lose that money and give it back to the state. So we were able to help out with the Sheriff's Department with their Project Lifesaver. So we were able to help them buy some antennas and some receivers. And so we gave them about $4,800. So that was a kind of a nice thing to be able to help out with law enforcement. The other thing that I have that is kind of a new that we are starting out, which I'm pretty excited about, is with nurses and social workers. What we are doing is we are having the nurses go out on certain situations with our social workers, because when our social workers go out and do investigations, talking about adult protective services and children and youth, the social workers have to be lawyers, doctors, nurses. I mean, they have to be everything. So this way here, what we have done now, and we had really a successful case last week or 2 weeks ago, but is having the social workers, if they're going out when there's concerns of injuries to children or babies that are failure to thrive, for the nurses to go and they can't give diagnosis or anything like that, but maybe they can strongly suggest, like, we do need to, looks like the child needs extra help or needs to go to the doctor, or needs to go to the hospital. So I know that the social workers and children and youth are very excited about this because I think it's just kind of gives them a sense of relief as well. And also in adult protective services is going into homes that where there's maybe sores or on elderly people that haven't moved for a long period of time. And you know, with a social worker going in there, it's really nice to have that nurse go in and saying, you know, this person does need hospitalization. We need to, you know, maybe call ambulance. And it's just nice to have that expertise that the nurses have. So that's something new that we are working on.
I was gonna say what we're seeing too with the nurses or like you said, that you have to be everything. Most of these individuals that you're working with, it's not like there's one issue that they're dealing with. It usually stems to 7 or 8 different areas that we work with. It may be law enforcement, it may be the humane officer because they have pets also, or it may be, like you said, a child. It may be just their mental health. It may be financial abuse of an elder. It all of a sudden it stems. It's usually not like, oh, you came in and I just had a sore or I just had an issue. Same with
there's a
law
reason.
enforcement. When we get a call for animal cases, 9 times out of 10, it's not just about the animal. It's a call to Health and Human Services because there's more to it. There's a reason that that care of that animal
The
got to that level.
pneumonia levels in the house, you know,
Yeah.
too, for the elderly or for the children too. It's nice to have that nurse for that expertise.
I'm not sure exactly how it works in that, but I would think that on occasion, maybe more so than I would think, the social worker is going to the house on their own by themselves. So having that second person, I would think would be a comfort zone to have another individual that's with you to help
Oh,
with those situations. So I like that idea a lot.
Absolutely. And also too, if there's like dangers, we'd send law enforcement with the social worker and the nurse too, just for safety that, but you're right, to have those, another set of eyes is great to have. Otherwise, that's all I have for our agency updates. Personnel, I don't want to jinx myself on this. So, we just need somebody in the children and youth, but I don't want to jinx myself, so things are going well right now. All right.
That's good. All right. Not unless you use your microphone, Sally. Thank you.
What I want to say is when I came on, I'm a community member. I'm not a board member. And the person ahead of me told me, speak up. Because they are looking at it through the money. You're looking at it through the families. That was told to me. So I'm trying to fulfill that.
And you're doing a great job. We appreciate that. Appreciate all of you. All right. Well, I believe that's it. We've had a long, very informative session here, and I thank you all for being here. And so without any objections, I adjourn this meeting. Have a great day. Oh, the next meeting is March 12th.